My name is Elspeth Matthew and I'm presenting this on behalf of Claire Goodman and colleagues. We work in the Centre for Research in Public Health and Community Care, CRIPAC, at the University of Hertfordshire. I'm also involved with the ARC, the National Institute of Health Research, NIHR, Applied Research Collaboration East of England, and I am co-lead of the Inclusive Involvement in Research theme. I included the link to our ARC theme on there and my Twitter name if you'd like to follow me. This presentation gives you a flavour of how some of our research work on dementia care and supporting people living and dying with dementia in care homes has been used to support care home staff during the COVID pandemic. It describes how we used research evidence to develop a set of heuristic or rules of thumb for care home staff. Top tips for tricky times. TTTT. The opportunity to contribute to the University of Hertfordshire's changed world has given me a chance to reflect on the past 6 months and the relevance of our research work at times of crisis like this. When the COVID-19 pandemic started back in early February-March 2020 in the UK, research staff were asked to work at home. As researchers, we were not involved in any frontline COVID activity, and initially some of our research was paused. It left us wondering how we could help frontline staff. For the last 6 years, I've carried out voluntary work with a local charity which runs weekly support groups for people living with dementia and their families. The activities include singing, dancing, lots of cups of tea and chats. The social side was an important part of the group, recognising the difficulties and challenges that these couples face. When our weekly cafe stopped meeting face to face, I rang couples once a week to keep in touch. There were many stories of resilience and sadness over the weeks and now months. A number of the couples have experienced admission to care home during this time and describe the difficulties of keeping in touch without face-to-face visits and worrying about health conditions and catching COVID-19. COVID has hit people affected by dementia particularly hard, as so much of their well-being is tied to personal interactions and physical reassurance and presence. And this is particularly evident when they need to move and live in a care home. At the Centre for Research in Public Health and Community Care, we have led programmes of research with care homes and on supporting people affected by dementia, including a national evaluation of dementia-friendly communities. There are approximately 420,000 older people in England and Wales living in care homes. Some care homes have on-site nursing, but many only provide personal care. They do not have medical health care providers on site. Care home residents are a group of older people who need extra support to live well, with 70% having some form of cognitive impairment, 76% have mobility problems as well as multiple health conditions. At the start of the pandemic, it seemed as if the focus was on the NHS, and social care and care homes were only thought about as a solution for helping hospitals free up beds for people with COVID. For example, the statistics of people dying in care homes were not initially included in figures. Care home staff were facing challenges they had not encountered before, and initially there was minimum guidance on infection prevention, use of PPE, and what the experience of caring for someone with COVID might be like. The background to our research. The project I am describing here was a response to questions and concerns raised by frontline care home staff during the time. They were members of a WhatsApp group which was hastily convened to pool knowledge and share concerns which included care home staff, relatives and those interested in care homes. Our aim was to complement emerging COVID-19 policy and practice guidelines with research evidence-based tips. As researchers, we sought to answer the questions, not with guidance that was already out there, but using our skills to search the published research evidence. We carried out a number of rapid reviews of the evidence and drew on our own research findings to answer care workers' questions about how to support residents, family members and each other alongside changing government guidance. This was a time of unprecedented pressure whilst also trying to adhere to guidance on social distancing and isolation. Some of the care home sector-driven questions covered areas such as: how can we support residents who need to self-isolate but because of their dementia did not understand and wanted to walk around the care home? How can we support relatives who are stressed and potentially grieving at a distance when relatives can no longer visit and contact is now limited to telephone and online platforms such as Zoom, WhatsApp and FaceTime? Are there any alternatives to close contact with residents? What can we do if we can't hug the residents? These were some of the questions that were being raised by the care home staff. Co-production of top tips. Gaps in the research evidence. The research often set out what care homes should do with limited recommendations for how they should do it. By examining the research findings, we sought to identify some rule of thumb that could help staff to think through the issues based on what was known to work. Our rapid reviews were then organised into top tips format, a series of bullet points setting out what was known to work, what might help, and what might be worth thinking about. We shared the first drafts with care home staff who provided feedback, and the top tips were then revised. Feedback was generally positive, saying that they provided reassurance, and it was felt that the top tips would be ideal for new or junior staff who would be working in such different times. Others found it helpful that it set out a way of thinking about issues, and in some cases reassured them that they were not missing anything. This approach shows the benefits of working with the care home sector to co-design and co-produce resources that are research-based for use with and by those who work and care for care home residents and for residents who live in the care homes. The top tips are freely available on the ARC East of England website. You can register to access the top tips and read more about how they were produced. The 8 topics that were covered: when residents don't understand physical distancing, supporting residents at the end of life where there is uncertainty, providing physical comfort and reassurance to care home residents during COVID-19, hydration and COVID-19, using music to provide comfort and reassurance for care home residents living with dementia, supporting staff following multiple deaths in care home environments, supporting families at a distance, and helping care home residents to use video to communicate with their families. All of this was especially important for those residents living with dementia. One of the topics care home staff were interested in was how to provide comfort to residents during the pandemic when physical touch and reassurance was difficult, especially when staff were wearing PPE. To address this, I carried out the review of providing physical comfort and reassurance to care home residents during COVID-19 with Francis Bunn. We found reviewed evidence on alternatives to human physical contact for reducing distress in people living with dementia, such as the use of soft toys and dolls. While there is also literature for pet therapy and animal robots, this was discounted as the tips needed to be practical and achievable for care homes with limited resources. Dolls and doll therapy have been found to have a positive and soothing effect for some care home residents living with dementia. The research provided specific advice that the dolls should be lifelike, have soft texture and open eyes, and that staff should ensure the dolls were personal to each individual, but not assume that they should have them all the time, because this could be tiring. It also flagged issues around infection prevention. There was advice too about how to address the discomfort that staff and relatives might feel seeing residents with dolls and the concern about infantilisation. From top tips to use in practice. These resources, as I've said, can be downloaded from the ARC East of England website, and to date there have been 346 individual downloads, and we're following up their use in care homes to refine and roll out the resources further. The top tips have been endorsed by the Welsh Government and also translated into Spanish. This collaborative work with a core team of researchers from 3 universities across 2 ARCs took 4 months to plan, develop and make the top tips freely available on the East of England ARC website. Additional dissemination work, including a published peer-reviewed paper led by Anne-Marie Towers at the University of Kent, setting out the rapid review methodology and a review of the emerging policy guidelines, was written and published 7 months from the start of the research. The work has also been presented through national and international care home sector webinars. One of the key international research groups for sharing resources and research in long-term care is the International Long-Term Care Policy Network. The future. Reflections on a changed world. Colleagues who are part of the initial discussions with care homes continue to work with the care home sector, and we hope it's part of a continuing conversation and dialogue. This area of social care is an area often neglected in terms of priorities, and we value the opportunity to work on this important area and cannot underestimate the difficulties that care home staff have faced and sadly will continue to face as the pandemic continues. It was an example of researchers mobilising their knowledge to work with practitioners to find a useful way of using research to inform day-to-day care. It wasn't a substitute for professional guidance and know-how, but it did provide extra support. Often research findings cannot give clear instructions. It takes time to build an understanding of what works. However, the systematic approach that research offers provides a way of making sure that care decisions are based on the best available evidence and can be reviewed over time. Too often, research stops at the findings and we expect it to be obvious how it should be applied. Our approach here recognised the importance of working with practitioners and starting with their priorities and questions. Going forward, we are asking if and how this has affected care. And lastly, it was a privilege to be able to respond and contribute to something meaningful, immediate, and work with a rapid turnaround. There was real motivation to collaborate and work on questions suggested by the care home sector. This was demonstrated through our commitment to embrace the changes to working remotely, at home, by utilising technology to work as a multidisciplinary team across regions. And the acknowledgements. I'd like to thank my colleagues, Catherine, Francis, Claire, who led this piece of work, Angela, Mel, Andrea from the Centre for Research in Public Health and Community Care at the University of Hertfordshire, Tamara, Diane, Lee, Florence, Anne at the University of East Anglia, and Anne-Marie at the University of Kent. We'd like to thank Julia Reeve for the design of the top tips. And this work was supported by the ARC East of England and the ARC Kent, Surrey and Sussex. The views expressed are those of the authors and not necessarily those of the NIH, the Department of Health. Thank you very much for listening.